with news from the UK. A new virus strain has wrecked Christmas for the Britons, and British Prime Minister Boris Johnson has reversed the plans to ease curbs over Christmas because of rise in cases fueled by this new variant of COVID-19. Boris Johnson has announced a stay-at-home order for London and South East England, which is home to around a third of the country's population. And according to Johnson, early data suggests that the new strain could be up to 70% more transmissible.
It is with a very heavy heart, I must tell you, we cannot continue with Christmas as planned. In England, those living in Tier 4 areas should not mix with anyone outside their own household at Christmas, though support bubbles will remain in place for those at particular risk of loneliness or isolation. Across the rest of the country, the Christmas rules allowing up to 3 households to meet will now be limited to Christmas Day only, rather than the 5 days as previously set out.
Opposition Labour Party leader Keir Starmer has supported Boris Johnson's decision, even though millions will be upset and heartbroken by this.
And I think people will feel very, very upset and heartbroken by this. Everybody knows that after this year of all years, families wanted to get together to see loved ones. But these measures are necessary, and we do support the government in these measures.
Within minutes of announcement of an effective lockdown on over 16 million people in England, shoppers hit the streets for a final attempt to stock up on Christmas presents and supplies. The measures will mean around a third of England's population cannot travel or meet people in other households for Christmas. People will be required to stay at home except for essential reasons, such as work, and non-essential retail will close, as will indoor leisure and entertainment. The new rules came into effect from midnight on Saturday, which will last till the end of the month.
See, I think it's the right move at the moment with the current new strain coming into, coming into the area. It can be quite serious, and we don't want to overwhelm the NHS because if we do that, then how can we effectively treat everybody that will come into contact with this new strain of the COVID virus?
Of course I can't go shopping, but as far as Christmas is concerned, they can put Tier 4, but realistically, they can't actually stop people going to see their families. So on Christmas, there's a good chance, my auntie and my uncle will come round. They're putting these restrictions in, but they're not actually really enforcing them. So I don't really feel like they actually mean anything.
Scotland would impose a ban on travel to the rest of the United Kingdom, and the Christmas easing would be limited to December 25th only. A strict travel ban between Scotland and the UK will remain in place over the festive period to try and stop the spread of this new variant of the virus. Both nations confirmed cases of a new mutation of this virus.
Secondly, in order to reduce the risk of more of this strain being imported into Scotland, we intend to maintain a strict travel ban between Scotland and the rest of the UK. Unfortunately, and I am genuinely sorry about this, that ban will remain in place right throughout the festive period. We simply cannot risk more of this new strain entering the country if we can possibly avoid it. That means people from Scotland not visiting other parts of the UK and vice versa. Cross-border travel for all but the most essential purposes is not permitted.
The Netherlands also reported a case from the same strain, and the Dutch government has also banned all passenger flights from Britain until January 1st. And UK started a mass immunisation programme earlier this month, and as he announced a new tier of restrictions for parts of UK, Boris Johnson gave the update on the vaccine figures as well. 350,000 people had so far received the first dose of the coronavirus vaccine in the UK. And for more on this, we are being joined by Dr. Julian Tang, who is an honorary associate professor and clinical virologist at the University of Leicester. Thank you so much for joining us. Now, there has been a significant rise in cases due to this new variant, and earlier we had spoken to you about the transmissibility of a new strain. From what we've gathered and what we just mentioned, this new strain is about 70% more transmissible. What can you tell us about this?
Okay, so I haven't seen that data yet. I mean, the number of cases were rising anyway in the last few weeks after coming out of the lockdown in London. London emerged into Tier 2, which also helped the virus to spread. In fact, one of the mutations in this new variant, the N501Y mutation, has been around since March, April in other countries, in Australia, USA, and Brazil. So it's not a new mutation per se, but the way it's spreading through the UK population seems to be more extensive than previously, and that may be partly due to the relaxation of the lockdown measures as well.
All right, but then how do you think this will affect the progress made so far in terms of understanding and combating the virus?
Well, the virus mutates all the time. This is nothing new. There are lots of variants already documented, different clades, different lineages. And in fact, this B1117 lineage actually has been documented earlier in a Eurosurveillance article covering January to June 2020. But it's just the way it's spreading in the UK population. It may require some additional mutations that may have enhanced the spread, plus the post-lockdown tier 2 relaxation may have helped that as well.
All right, but do you think this could lead to a potential change in the COVID protocol and vaccine development, considering that many countries have already begun mass inoculation programs?
No, the mutation's is a fairly minor one in terms of the overall protein structure. So it's not going to affect the vaccine significantly, we think. And don't forget, the other lineages that are circulating also have minor changes in the spike glycoprotein, and we don't think they will affect the vaccine. In fact, some of the clinical trials are actually conducted in the presence of these different circulating strains of the virus, and the clinical trial data are very good. So I don't think that's the main issue, and it's not really more severe either in terms of clinical disease. Transmissibility seems to be the main feature, but I haven't seen the data, and I don't know where they get the 70% from. But that might be due to the number of viruses with this variant mutation in it that they're finding in the positive cases so far.
All right, Dr. Tang, thank you so much for joining us with all those details. We will continue to track this closely.